thanks for joining us again. She's about to be in his side. Annie Cross, actually. Are you right there, Annie? Annie. She's been really nervous. She's very quiet there, Annie. Are you alright? Annie.
Alright.
Are you alright,
Annie? Yeah, come in a bit closer if you want it, Dad.
Annie. Annie. You are very quiet, my love. So Annie's 9 years old. She's about to have an appendectomy. She's got a really wobbly front. All right. So
we'll be getting you off to sleep in a moment, Annie. All right.
I thought
you have to have some nice dreams. This is where you think of something nice. Dad's just here. Dad can hold on to your hand if you want.
I'll probably intubate her. Well, yeah, we'll just get her off to sleep, and then what I might do once she's got off to sleep is I'll go and see the next couple because they've just booked a laparotomy and one or two other things. But it's laparotomy. So once she's off to sleep, so I'll leave it with you once she's off to sleep. Is that right? Yeah. Annie, just going to give you a little bit of oxygen to breathe. All right? She's already got a cannula in, to be honest.
My tummy hurts.
Your tummy hurts. Oh, sorry, love. All right. All right, right, Dad, are you okay there?
Yeah.
You sure?
Yeah.
You can hold on to her hand if you want.
Okay, a little bit of oxygen
Annie.
to breathe, Annie. All right. Okay.
Well done, sweetheart.
Okay. So she weighs like 44 kilos, so that's a mite per kilo of fentanyl. All right, and that might sort of make you feel a bit woozy now, too. We're going to have a rapid sequence. So
Okay, yep.
once she's away, once she's just feeling properly sleepy, then we'll do a bit of cry. Okay.
No problem.
I think the airway just looks slightly dodgy, and with that loose tooth, I might just go for a bougie straight away, if that's
no problem.
all right. Right. Okay, Annie, just gently off to sleep there, so we're oxygenating reasonably well. She had been saturated about 93, 94 in the ward, but she got a nasty appendix, and she was doing a lot of guarding, so
Well done, Annie.
but actually she's come up a bit with pre-oxygenation there,
We'll start thinking of something nice.
but it wasn't so good on the ward.
See you very shortly.
Right. Okay. Annie, are you alright there? Annie!
That's great, Dad. So, one of the healthcares is just outside the door and we'll take you through to the waiting area. Is that okay? Thank you so much for your help. All right, take good care.
1.2 milligrams per kilogram. Okay, Dad. Thank you. I didn't have much to say, so did he?
No, I think it was a bit of shock. I think he's. I think because they were saying.
Crack mate.
Yeah.
Crack
They thought.
She ventilates okay there. This is stressing me out though. They've chopped and changed like nobody's business. I mean, you can't get the general solutions don't seem to help the team. We've got 8 cases to do.
Yeah.
And it's like, oh, we'll do that one. It's absolutely bonkers. We're on about 30 seconds there. Just absolutely stupid. And then the plastics one do something. And then Gani wants to come in with this torted ovarian cyst. And it's just madness. They just don't seem to organise
They need to just communicate with one another.
You want some sevoflurane on?
Yes, thank you. We'll just, we'll just give it a twist. Have some thank you, sevoflurane on. To be honest, I was doing this as a rapid sequence, even though I was bagging there. But I need to avoid that tooth.
Yeah.
Because so it's just driven me absolutely flipping bananas today, I have to say. But I can see the cause. She's not easy, actually. God.
Want any more manipulation? Is that okay?
No, that's all right. Okay.
That's all right. Okay, so
Just I couldn't
tube's
see.
going on.
It wasn't very easy at all.
Right. Okay, so tube is on. I have the bougie.
I blame the surgeons.
Sats are good. 98. Happy there.
Should be all right.
Bougie out.
Okay, bougie out.
Okay, bougie's out.
Right.
Stuff's gonna go up.
Right. That looks all right.
Cuffs
Okay,
up.
so chest
My
rising.
sats are just dropping a little bit.
Oh, chest rising and falling. That looks all right. We got. We have fallen a bit, but we had this off a bit about the time, didn't we?
Pipe right off.
Yeah.
Yep.
Yeah. Well, chest rising and falling nicely.
Happy with where it is at the lips.
Yeah, that's fine. That's fine. Just stick it in. Right. So I've got we'll get a I mean, we can call the surgeons back now, can't we? And we'll get her into theatre. And then I'd better go and see this laparotomy. Apparently they're saying, reckon about 25% mortality, so it's like, well,
Oh dear.
what do you want to do with it if you've got 25% mortality? What's the morbidity like? Close to 100%? It's just absolutely ridiculous, really. Yeah, she was a bit hypoxic on the ward,
Ah,
but
it's
just
just
bad
put paper in with a finger.
So, yeah, I mean, it's like 25% mortality, 100% morbidity. What exactly are you going to do with them? She's 88. I think she'd had a Bressier primary. She's got a ischemic heart disease, CKD, creatinine's about 120.
Sorry, can I interrupt?
where
I'm just
is
a bit
the-
concerned about the stats
Absolutely.
there. If they're continuing to drop and she's been back for quite a while, I think we might just need to pay a bit more attention to it.
Okay, what do you want to do?
So,
I mean, they're sitting about 88. I think just bag her up, that'd be alright.
we've been bagging her for quite a while though, and they've not started to come up.
Okay.
The tube looks like it might be a little bit far in for her age.
Well, I mean, it was sort of 19 at lips, which, you know, she's sort of, what, 4'11", 5 foot. I thought 19 would be alright, to be honest.
Those stats are carrying up on her. Can I just have a little listen to the chest there? actually?
okay,
do
yeah,
listen to
stethoscope,
chest.
And just while we're waiting for a stethoscope, I'm just looking at the chest expansion. Is that equal?
Well, I mean, it looks alright to me, to be honest. I mean, she got slightly pigeon chest. Dad looks a bit like that as well, to be honest, didn't he? Do you know what I mean?
Yeah.
There and
It
three.
was very, very quiet.
Well, I don't know, can you hear her? What are you hearing?
I'll do it.
Can you hear it? I don't know, it should be. What do you think?
That sounds good.
Looks alright, doesn't it?
Sounds good.
What's going on? Sound alright, is it all?
Yes.
Okay.
Bilateral air entry.
What's going on? Actually, I mean, it's time to, it's continuing to drop. Let's see. I mean, she was quite septic. Sats in the water 92, 93, 94, which for a, you know, for a 9-year-old us was a bit strange. We've got CO2 there, haven't we?
Yeah. So I suppose other things to think of, as she aspirated while being intubating her, is there any signs of any soil in the airway there?
Well, I mean, it didn't. Well, I mean, when I tubed her, I saw the cords, and it did. I mean, there wasn't any soiling.
And we're worried about that tooth. Is that still in place, or has that potentially gone into the airway?
Which tooth was it with that Zeus again?
It was bottom left. Let's have a look.
Should
I
we,
think the
do you want me
tooth is
to
still
carry on
there.
squeezing the bag while you're having a look?
Well, no teeth. It's all right. Teeth are there, John.
Teeth are all there, okay?
Yeah. Yeah. Teeth seem to all be there. That's a good point, though, isn't it?
Okay.
I mean, I didn't see myself knock it out, but I mean, it's been done, hasn't it?
So just in terms of where we're at, where we're on 100% oxygen,
Yeah.
we've got the tubing, we've got end tidal,
Yeah.
we've got bilateral air entry and bilateral chest rise.
Shall I just have a listen to that chest?
Yeah.
I mean, actually, I did look more like 20 than 21.
Okay.
Let's have a look at it.
Sort of age-wise, we're looking at what is it, about
What's the
6. It's age over 2 plus 12, so we're looking at. So what's she 9? So we're looking at about 16 centimetres for tube depth.
Okay,
So
yeah,
potentially
so-
might be in a bit far.
She's 20,
I
isn't
think
it?
it's 20 there, isn't it?
Okay, shall we withdraw that
I mean,
tube
what
a
else could
bit?
it be? We're talking about sepsis. I mean, I doubt she's had a pee. That'd be a bit weird, wouldn't it?
Should we try and see if the tube depth is going to make a difference while we think about other causes, just because the sats are continuing to drop?
Really?
Yeah.
Do you want me to take this tape off for now? I'll
Yeah,
let you have
so
the
can we
tube.
withdraw that to
Yeah,
16
do you want to just, I'll let you
centimetres?
do
Just a
that.
minute.
Just,
Just bag her. It's quiet.
16 centimetres.
Actually,
and
in
other
fairness-
things to look at.
What have you pulled it back to?
16.
That is better.
That's better, is it? Okay.
right. Do you want me to go and get the surgeon so we can start? Or
We'll wait to make sure the sats have come up all right first and just make sure we're nice and stable because there might be
I'll
other
even
things
just feel
going
that
on.
in where it is.
And as I'm squeezing the bag there, does it feel like the airway pressures have improved at all?
Well, I mean, a compliance there. I mean, the peak pressure's come down a bit with that, hasn't it?
Mm-hmm.
Happy for me to secure it with
Why
some
is
tape
that
where it
still
is?
down at
Yes,
80?
please.
What else can be going on? So that did sound better. That definitely improved. on the
Other
left.
things to consider, I suppose, pneumothorax, if we've had high airway pressure and
Red
reduced
line.
air entry.
Well, that's true. But that has got better on that
That's
left
better,
face.
is it?
But yeah, let's have a look at both apices. Yeah, I mean, both agencies, you can hear air entry.
I'll take them up to the pressure.
And check,
I
we're
mean,
definitely on
air
100%
based
oxygen there,
agencies. I mean,
and we're at reasonable flows. And I know we did turn the SEVO on, but it's not coming up there. Just obviously we'll want to make sure she's appropriately anaesthetised as well.
yeah.
Tips.
I mean,
I'm just going to have a look at the quick reference
I mean,
handbook.
it had to slip down again a bit
Okay.
to 18 there. Can we just make sure that stays back up at 16?
Yeah.
That's a good idea. Quick reference handbook's a great idea. I'm just going to seriously take that back to 15, 16 there. Just because it had slipped back into
Actually, just
18.
going to put her on the ventilator to free up her hand.
It's a good idea.
40 kilos.
Yeah, thanks, John. That's a really good idea.
So, adequate oxygen delivery. So we've got 100% oxygen there with appropriate flows, and the measured FiO2.
Yeah.
I'm guessing that's not accurate, or
Well, it should be accurate,
okay.
shouldn't it?
So it's only coming up with 50% FiO2.
But it's not 100%.
Yeah. So have we got appropriate oxygen supply? So we've got an O2 cylinder pipeline. Pressure's okay.
Yeah, they've checked it before the case. Yeah, pipe
It's
pressure's
good.
all right. Got backup on the back as well.
Okay. Looking at the breathing circuit, everything looks like it's connected all right. Tube's connected. There's
It's not pulling,
nothing.
is it? No.
Nothing open. Those sats are starting to come up a little bit.
So,
Ventilator bellows, I mean, we can't physically see
Right.
that, but we can see that there is ventilation and there's chest
but I see
moving.
you've put a lot of PEEP on there, which will have
Oh,
re-recruiter,
yeah.
so that's useful. So, what else is on quick reference handbook, John?
So I'm just going through the ensuring adequate oxygen delivery.
Right.
So
That's still weird
Saturations.
that monitors all over the shop, isn't it? But we are giving 100% oxygen.
Mhm.
Keep going, please.
so ensuring saturation is accurate. So it's on the blood pressure cuff arm. We could consider that moving over to the other
Good
side.
idea, yeah.
I think we'll see if that makes any sort of difference. And
But
just
it's doing a
having
better reading if that's an help.
okay.
But come on,
And
please
just
continue.
Sort of quick look, does perfusion, sort of colour in the peripheries look all right? Just so we can
I mean, she looks. I mean, you can tell us that's a 92. She's not
sure.
pink,
Okay.
but she looks probably, in fairness, a better colour.
Okay.
She is perfusing her peripheries.
So then moving
Feels
on
like
to the next part of the quick reference. So airway position. So we've had a look at the tube depth. We've drawn it. Is that still at 16 centimetres?
I've
So
gone back to 18.
Okay.
18
I've
and
put a
half,
little bit of
as it
tape
pulled
on
back
here
in
just
on
to
tape.
stop
Oh,
it
back
pulling.
to
So that's
16.
Perfect. And then we've listened for chest for air entry, and that's improved now.
Yeah,
We can see we've got chest
definitely
expansion.
better on the left there.
That's a 96 now.
Perfect. Capnograph is compatible with a patent airway. I'm happy that things have started to improve now, so I think
Okay.
we can.
Just what we went on is auto for the blood pressure.
Okay, sure.
So I'm going to just, so I've put that on auto now. Because we're at
Fluid's ongoing as well at the moment.
That radial pulse in fairness feels good and bounding.
Okay.
What else
So I
is on
think-
the reference handbook?
So, looking at the patency of the airway, so it suggests passing a suction catheter, but given we've had an improvement, I
And
don't
we
think
have-
that's
yeah, let's
necessary
not
at this
mess with
point in
it.
time.
Yeah.
So I think we've sorted out the problem that we had. I think
Yeah.
rather than continue work through
Yeah.
the quick reference handbook, I think
I
it's
think
worth
we're
moving
good
back
with
to an
that.
A2A assessment and
Yeah.
then getting the surgeons back in.
I think you're right. I think we can be confident of starting, can't we?